Hello, my name is Steve Leslie, and I'd like to tell you about the history of Highland Hospitals project, and more specifically, the changing face of Highland Hospitals. Now, about 12 years ago, myself and Jim, my father, established the history of Highland Hospitals with support from others and a project group. And at the end of that 2-year specific project, produced a preliminary report on the Hospital of Highland Region. That report and subsequent discoveries have found over 60 hospitals that existed at one point or time in Highland Region. Subsequent to this preliminary report, 4 books have been developed and published looking at the history of hospitals in areas including Nairn, Lochaber, Inverness and Skye. And what I'd like to do for the rest of this talk is to talk about the changing face of Highland Hospitals, thinking specifically about the different types of hospitals that were developed, the funding and the beds that were available for local patients. So when we think about the hospital types and funding, one of the challenges at the beginning of the project was to determine or decide what actually a hospital was. It was called a hospital, and that was fairly straightforward, but other institutions provided healthcare, and we're thinking in particular of poor houses, and so we have included the poor houses today. In Highland, there were also infectious diseases hospitals, TB sanatoria, psychiatric provision, maternity, military, as well as industrial and a local dispensary called the Forbes Dispensary, which was very important in providing healthcare and medicines pre-NHS. Now, when it came to funding these early hospitals and establishing them, this was challenging because generally the Highlands had a general poor population and didn't really have the wealthy middle class that you found elsewhere. Many hospitals were created based on voluntary subscription, so the local population got together and provided money and raised money to create a hospital, but others were endowed by usually a single benefactor by a huge endowment or an estate that was given to support the hospitals. And some throughout their history changed between endowed over to voluntary prior to all being taken over by the NHS at the inception of the NHS. Now, this is a list of the general hospital beds, and you can see that with the exception of the Northern Infirmary, which had 69 beds, most of these were rather small hospitals, all less than 20 beds. Those in bold were initially developed by voluntary contributions, whereas in italics they were endowed. And as I said, these sometimes change. So for example, the Belford Hospital started off with an endowment from Andrew Belford's estate, a rich solicitor, but subsequently became a voluntary hospital when the money ran out. If we look at the structure of these hospitals, these were some of the earlier general hospitals, and you can see the style is very much the style of a large mansion house. The Northern Infirmary at the top, this is the original building in 1804, but was subsequently expanded considerably in later years to give the building that we now have next to the River Ness. Nairn Town and County Hospital, this was the original building in 1847. It still exists now as a residential dwelling house, but you can see it just looks like a big house really. And same with the Belford in Fort William. This building now no longer exists, having been demolished, but again the style of a large mansion house. Belford, when it started, really it was quite small in terms of the number of patients it could take, so 12 was the number in quite a large building. When we look at later general hospitals, they start looking a little bit more like a hospital with pavilion style buildings. Lawson Memorial in Golspie, established in the 1900s, and this building is still there. The Ross Memorial Hospital in Dingwall, established in 1873, and that's our longest standing hospital in Highland, having been continuously used as a hospital from 1873 to the present day. And I was giving a talk to some visiting Germans from Augsburg, because they're twinned with Inverness, and they were looking at setting up a medical school in Augsburg, and they have a massive modern hospital with a helipad on the roof. And I showed them this building and said, look, this was one of our original hospitals, and it's still being used as a hospital all these years later. And they were really quite aghast that this type of building in this day and age could still be used as a hospital facility. And of course, we've got Nairn Town and County. And this is a picture taken soon after its building, and it still exists today, although with large extensions at the back with the new hospital. And the other style of hospital that was created in the Highlands and still exists are the cottage hospitals. Here's the original Mackinnon Memorial Hospital in Broadford and Skye. And this was a voluntary hospital, and indeed it took 20 years for the local population to gather the money, to raise the money to develop this hospital, which was named after one of the local ministers, Dr. Mackinnon. The Ian Charles Hospital in Granton is still in use, although soon to be replaced by the Aviemore Healthcare Centre. The Ian Charles Hospital was run initially by the Seafield Estate. And the John Martin Hospital in Uig, it was created with a large endowment from John Martin, mainly from colonial funding, but even with a large amount of money, it was not able to fund itself wholly and throughout the year. So for a month every year, the hospital was closed and the patients were sent home. And it was during this month that the cleaning happened. But, interesting to think that a hospital would just close because of lack of funds and the patients would be sent home. I mentioned earlier the poorhouses, and these were established after the Poor Law in 1845 made it mandatory for parishes to provide poorhouse facilities for the local population. And within that, there was a requirement to provide a hospital or sick beds. And you can see the number of sick beds. We don't know exactly how many there were, and often the use of these increased or decreased depending on the need, but around about 100 sick beds were created in Highland poorhouses. Now, with its dispersed population, Highland had a slight problem because, with the exception of Inverness, none of the parishes were big enough to actually create their own poorhouse. So you can see here that these are called the Black Isle Combination Poorhouse or the Skye Union Poorhouse, and that's because there had to be a combination or a union of parishes together to create a poorhouse. And this caused problems when you have a dispersed population and the poorhouse wasn't local to where it was needed. So I think the poorhouse worked reasonably well in Inverness, but perhaps not so well in the more remote areas, and maybe quite a good example of centralised legislation not working particularly well in the more remote and rural dispersed populations. Now, if we look at the structure of the poorhouses, they were rather austere buildings. At the top left, you can see the Sutherland Combination Poorhouse, and while they provided a small number of sick beds at the time, these are very important in the general history of Highland hospitals, because after they're finished being used as poorhouses, many of these morphed into hospitals. So the Sutherland Poorhouse became Sworddale and then Migdale Hospital, and existed as a hospital until 2011. So although this was never designed as a hospital, it actually served a hospital function for 150 years. Inverness Poorhouse, which can still be seen at the bottom of Old Edinburgh Road. It's now residential flats. Was initially obviously designed as a poorhouse, but then was subsequently Hilton and Muirfield hospitals, providing general care and geriatric hospital beds. Nairn Combination Poorhouse, so the building established in 1861, has subsequently been demolished. Now, if we move on to infectious diseases hospitals, these are a selection of the hospitals that were around in Highland. There were others, and many were temporary facilities. So there was a company in Glasgow called the Spears Company that actually provided temporary hospital accommodation, usually built out of wood and corrugated iron, that could be put up in response to a local outbreak of smallpox or other infectious diseases. And again, there were a range of buildings here. You can see some larger facilities with a Northern Infirmary fever ward, and at the bottom of the list with Culduthel and the county in Invergordon. But again, in the middle, many of these were rather small and often underused facilities. And here are some of the different examples of infectious diseases hospitals that existed in the Highlands. In Cambusavie, established in 1906, this was a hutted facility, the separate buildings being used for different infectious diseases, so you could keep them separate, because of course one of the issues was of cross contamination, and they didn't quite have the same PPE that we're using today, and therefore that was an issue. So therefore, to keep them separate in different buildings was thought as an important thing to do. Some of these are Spears constructions with corrugated iron roofs and wooden walls. You can see Culduthel Infectious Disease Hospital. This was a mansion house which still exists as a residential property, with the wings on either side, which have now been demolished. But again, during its time, it had separate pavilions for different diphtheria or scarlet fever, to try and keep the infectious patients separate from each other. Because one of the roles of the infectious disease hospital was really to isolate these patients, because sometimes the treatment was very supportive, and many of these patients lived in overcrowded facilities. So you can see here, the top right, another method to isolate patients was to take them out of their house in this mobile van van that could be taken horse-drawn, that could be taken to the scene of the outbreak in the village, and this was used in the Black Isle, and this could house a few patients inside to keep them separate and try and prevent community spread. Invergordon in 1921 was a military hospital at a large number of beds, but often these were not always filled or used because of a lack of funding from local authorities, and there was quite a lot of dispute about who should pay for fever accommodation for patients. Of course, one of the other scourges in terms of infectious disease was tuberculosis, and Highland did have a range of TB facilities. There were three main sanatoria. The Seaforth TB Sanatorium at Maryborough is one of the prettiest, I think, and you can see the plan here. It was designed with a central admin block and the rooms out to the side with the full length windows, which were actually doors that could open out so that the patients could be nursed in the fresh air and kept separate. Bottom left is the Inverness-shire Sanatorium at Invergarry, and the Grampian Sanatorium, which was actually in Highland Region, this is now St Vincent's Hospital. These were mainly for pulmonary TB, but of course bone TB was quite a problem as well prior to treatment, and Raigmore was really the centre where these patients were treated, often in the outdoors, and you can see patients here being treated outdoors under a veranda in the fresh air, which is thought to be a key part of the treatment at that time. If you want to see the Seaforth Sanatorium, it still exists as a facility for adults with learning difficulties, and the St Vincent still exists as well, but the Inverness-shire Sanatorium has been demolished. Mental health, when you research the history of mental health really throughout the UK, it's really some shocking stories, and the Highlands were no different, and there are some really shocking stories about how patients with mental health were treated in the past. And in 1864, the Northern Counties District Lunatic Asylum was established, and it was really seen as quite a leading facility. It got good reports. It was a little bit innovative in that it had no walls, so that it's an open hospital for psychiatric patients. It had a working farm next to it, so there was gainful employment for many of the patients. It was a beautiful building. The interior, you can see the top right-hand corner, this is a lady's sitting room, and really quite an opulent style of living. It was designed for 200 patients, but at its heyday was accommodating over 1,000. So there was overcrowding was a major issue. You can see in the middle of the picture here, there's a rugby pitch, and just to the right of there, what was called the sports pavilion. But actually, this was designed as the TB sanatorium again, with the central block and the wings to either side with individual rooms. Another area of medicine where some of the past practices were perhaps not ideal was the treatment of women, particularly unmarried women, with regard to maternity services. And generally, hospitals were late to provide maternity services, with many of the male-dominated management committees resisting it quite forcefully. And there were, as a result of this, maternity houses in Inverness, one being Ida Mary at what is now the Craigmony Hotel. But you can see here, here's the hospital wings being opened in Nairn, Town and County, Ian Charles in 1923, and the Rosedene Maternity Hospital in 1940. Rosedene and Raigmore provided shared the maternity service in 1947 when Raigmore was opened, but subsequently Rosedene closed, and the Raigmore facility greatly expanded in 1951. But interestingly, the first maternity hospital in the Highland region was at Fort George. And in 1913, they had the Families and Maternity Hospital at Fort George, and the hospital block to the right here of the picture is the maternity unit that could house 2 or 3 maternity cases. And I think it had up to 27 maternity cases in 1 year. So it was a fairly well-used facility. Of course, military provision of healthcare was quite important, and during the First World War, there was a huge number of patients returning from the front, a lot of casualties, and this was the provision for those mainly through the requisition of large houses. So here's Ivy Bank in Nairn being used as a Red Cross facility. By the time the Second World War had come along, again there was this concern about a large number of people returning from the front injured, and there were 7 emergency service hospitals created. One of these was in Inverness in 1941. And this is built on the Raigmore estate. If you look to the top left of this picture, you can see the original mansion house, Raigmore Mansion House, which now sits where Raigmore Estate is. The house is demolished. And down at the bottom, you can see the walled garden, which of course is now the car park at Raigmore Hospital. And these were rather dispersed design to, if it were bombed, then it sort of spread the risk. They were single-hutted brick structures, very cold, not insulated very well. And I still remember in the 1980s visiting a relative in one of these hutted hospital buildings. But of course, the tower block has replaced most of these, although some of them still exist on the Raigmore site if you want to see an original 1941 Raigmore building. So I started by saying I was going to talk about the changing face of Highland hospitals. When John Dewar reported on local hospital, he was very supportive of these and thought that they were a very important part of local GP providing healthcare to the population. And his suggestion was that they should be supported and expanded in both scope and number. Unfortunately, or what has actually happened is the complete opposite, where there's been a centralization, partly due to financial matters, partly due to medical advancement and specializations, centralizing resources, and of course improved roads and air transport, perhaps making local hospital care less relevant than it was in 1914. If we look at what happened to the bed numbers, this graph is very interesting. The orange line is the population of North Highland, which you see has gone up and down a little bit. Generally, there's a fairly flat line when you compare it to the blue line, which is the total number of beds in Highland. And you can see that it gradually increased from not very much at the beginning of the 1800s to a peak around the 1930s, 40s, 50s. and then a steady decline since. And this is up to 2010, but there's been a further decline since. And you can see the population is rising, but the number of hospital beds is reducing. And again, we could talk a lot about the wisdom or pressures that brings. So in conclusion, Highland developed most types of hospitals found elsewhere. There's a representative bunch of hospitals here. Communities were poor and often too poor to afford hospitals, and voluntary hospitals took a long time to get established. Often things were quicker if you had an endowed hospital with a single benefactor. Generally, hospitals were underfunded throughout their period and relied on ingenuity, public forbearance, and professional dedication. So many doctors provided their care free to the local hospital. Parts of the Highlands were deficient in medical care well into the 20th century, and we still have a rural divide and challenges providing rural healthcare to this date. And out with Inverness, most hospitals were too small to afford the expertise in certain medical procedures, and therefore doctors risked becoming isolated, and therefore attracting doctors to the Highland region was a challenge. And again, that resonates with the situation today, with it being difficult to attract certain subspecialty doctors to work in the Highlands. Generally, communities were proud of their local hospitals, and you can see that when, for acts recently, hospitals were being closed. For example, Portree and Skye resulted in a large outcry with local communities. But on the other hand, often they were underused in history, and large numbers of Highland patients actually chose to go to Edinburgh, Glasgow, or Aberdeen to have their treatment, bypassing the local hospitals. So there's a slight sort of tension there, and often local management of hospitals were trying to see what they could do to attract patients to their hospitals. So I'd like to thank you for listening. I've put up our email addresses for both myself and my father Jim, and our website. If you have any information about Highland hospitals that we would like to share, then we'd be delighted to hear from you, or any questions about any of the hospitals, then please get in touch. Thank you for listening.